Good evening and happy New Year's Eve. May 2021 be better. That is all I'm asking for. We made it through a very tough year, and I hope that we have the same plans tonight, staying home like Brandon there as well. So after a year of unimaginable tragedy, most people are looking forward to saying goodbye to 2020. As Wendy Woolfolk explains, though, with a new strain of COVID-19 identified in San Diego just yesterday and hospitals stretched so thin, this New Year's Eve will be unlike any other, but we can and will get through it.
Nowhere will New Year's Eve look more different than Times Square to ring in 2021.
You're going to see less people in Times Square, but we're going to be filled with more hope than ever.
Only invited guests, including healthcare and essential workers and their families.
They reflect those families watching at home, all those families in communities and cities, towns around our nation and across the world who have been sacrificing for their communities.
The final hours of 2020 give no relief to healthcare workers in places like Southern California.
We're full, we're at max capacity.
And now the arrival of a mutated strain of COVID-19 here in the U.S.
It was inevitable that it would be here, so you're going to be hearing about reports from other states and more cases in the states that have already reported.
At the same time, overworked state and local health departments are struggling to patch together plans to administer vaccines efficiently.
There's vaccine available and literally sitting in freezers. That's unacceptable. We have lives to save.
With the painful loss of more than 343,000 Americans in 2020, there is still hope.
It's the hope that as we say goodbye to 2020, we could say hello to 2021.
Happy New Year!
From coast to coast, a muted celebration of patience and perseverance for the new year ahead. Wendy Woolfolk, NBC News.
Yeah, this as preparations are underway at Yuma Regional Medical Center as the holiday surge continues to again overwhelm the county. With many people expected to gather for New Year's celebrations tonight, YRMC is anticipating yet another wave of coronavirus cases. The hospital says it's tackling the problem head on, though. More than 24 nurses with a wide variety of skill sets have been brought on to help with the influx of patients. The state is also sending in a strike force team.
We also have a federal team coming on board. We're expecting about 40 nurses, probably about 20 ICU and 20 med-surg nurses. And this is from a federal strike force team. They've been going around where the different hotspots are to help with staffing and so forth. And being as Yuma, as you know, is the only hospital for 150, 180 miles, it's really crucial that we have that staffing so that we can open the beds.
Yeah, Arizona also sent out a request on behalf of YRMC across other states for additional medical staff. The hospital says it is constantly checking where it's at in terms of staffing and supplies to make sure the demand is met. But again, if we all do our part, it will lessen the load for those on the front lines. Brandon.
Well, first things first, we certainly want to wish you a happy new year, Jenny, and to the folks at home. What a year it's been. I know we've all been through a lot. Let's take a look now at the numbers, though, and how they end the year pertaining to COVID-19. More than 2.2 million cases in California now. Over 25,000 have died. 91 new cases of the virus reported in Imperial County tonight, and 6 additional deaths related to it. In Arizona, more than 500,000 cases now and over 8,000 deaths. Now in Yuma County, the health district reporting 251 new cases today and 9 deaths. At last check, 127 residents were hospitalized at Yuma Regional Medical Center, 21 in the intensive care unit. As always, testing locations and resources can be found for free on our KYMA mobile app. Jenny?